Here are a few tips on how you can safeguard PHI. HIPAA requires we take reasonable measures to ensure that our client information is safeguarded. It is also required that we have policies and procedures in place for this purpose. The Department of Health and Human Services has a safeguarding policy. The policy provides procedures for the proper handling of personally identifiable information we maintain about clients and residents. While HIPAA protects information in our programs, which provide health and behavioral health care, client identifying information in all of our other DHHS programs, including social services, housing, income supports, and protective service programs, is also confidential based in their federal and state laws. For this reason, the safeguarding policy applies to all client identifying information in all of our service programs, not just health. Securing information from improper disclosure also includes sharing PHI with only those that need to know in a discreet manner, refraining from discussing patient visits, conditions, progress with family, friends, neighbors, and coworkers who don't have a need to know. Ensuring the disclosure of information reaches the intended person includes the following steps: validating fax numbers prior to faxing PHI, verification of identity prior to releasing information without the patient's present, and requesting verbal authorization from the patient to discuss their health conditions with those that may be present. Some DHHS programs do not provide direct client services but maintain identifying information about residents such as public health, disease control and surveillance, and licensing and regulatory programs. Information that DHHS programs have for residents is also confidential. These programs must also comply with the safeguarding policy. If possible, use a private interview room to meet with a client. Keep voices down if you must talk with a client in an open area. Do not discuss clients in common areas such as an elevator or in a hallway. Never leave confidential information on a client's voicemail unless the client has given you permission. Ask instead that the client return your call. Here are a few highlights for safeguarding policies. Always identify yourself by wearing a county ID or visitor badge. To protect written information, the following steps should be followed. Store client or resident records in a secure location away from public areas. Never leave client or resident information in plain view of others. Keep identifying information such as names or addresses concealed when walking in a public area. Keep records in a locked desk or filing cabinet or locked room even if you are leaving your office for a very short time, ensuring that those that require information for proper treatment, payment, or healthcare operations have access to the information they need to fulfill their job obligations. Limit access to information to those who do not require access to perform the obligations of their job. And lastly, secure workstations by logging off, using strong passwords and keeping passwords confidential. Remember, you must protect information in all formats, written, oral, and electronic. Even what you observe about a client must be protected. For example, if you see someone you know receiving or applying for an HHS service, you may not later tell a coworker, family member, or friend that you saw this person. Ensuring the electronic transmission of data is secured in a manner to protect the integrity of the data. Protecting data integrity may include using secure email or organization communication portals that transfer files within or external to the organization for treatment, payment, or operation purposes. Do not share with family, friends, or anyone else the name of a client or any other information that may identify him or her. For instance, it would not be a good idea to tell your friend that a client came in to be seen after a severe car accident. Why? Your friend may hear about the car accident on the news and know the person involved. Do not inform anyone that you know a famous person or their family members were seen at this department. If I am contacted by the media, may I release PHI to them? Or, if I'm contacted by an individual offering to pay me for PHI, may I release it to them? The answer is no. You may not release PHI under either of these circumstances. Both are grounds for disciplinary action. Refer the requester to the privacy officer. If I need to transport paper records or PHI to another department, is this okay? The answer is yes. You may transport documents to another department. But secure the documents by carrying them close to you. Carry the documents in a facility-designated bag, box, or container. Ensure no names are visible and ensure no records are left unattended. When necessary to transport PHI externally, place the document in a locked briefcase, a closed container, or sealed, self-addressed inter-office envelope. Take minimal amounts of information necessary with you. If you are visiting several locations in a row, take only records pertaining to each visit inside with you. Place PHI in the trunk of your vehicle, if available, or on the floor behind the front seat. Lock vehicles when PHI is left unattended. Please note, you may not transport patient charts between departments or off-site unless authorized by the Director of Health Information Management. When sending PHI in sealed interoffice envelopes, verify all PHI was removed from the envelope before stuffing it. Confirm the address is to the correct individual and department. Make sure to mark the envelope confidential and confirm you are sending the correct PHI. When safeguarding PHI in paper format, promptly remove client or resident information from copy, print, and fax machines. Remember, you must safeguard any piece of paper that contains client or resident identifying information, not just information in client or program files. Do not leave documents containing PHI unattended in fax machines, printers, or copiers. Check your fax machine frequently so documents are not left on the machine. How should I dispose of confidential paper? Shred or place all confidential paper in the designated confidential paper bins. How should I dispose of electronic media, such as a floppy disk, CD, or USB drive? Provide electronic media to the Information Services Department for proper disposal. How can I help protect our facilities? Wear your ID badge at all times. This helps identify you as a Department of Health and Human Services employee or provider. Only let employees enter through the employee entrances with you. Keep hallway doors that lead to patient care areas closed. Request vendors and contracted individuals to sign in and obtain vendor ID badges when visiting a restricted area. If you believe that a crime is being committed on our premises, contact security staff or the police as appropriate to address the threat. Notify your supervisor. Provide police and our security staff with the information they need to complete their incident reports. Document the incident and disclosure in the client record. If law enforcement contacts you to request information about a client as part of an investigation, do not disclose the information. Contact our privacy official or Office of Risk Management for assistance. In general, we cannot respond to investigatory requests without a court order. What are restricted areas? Restricted areas are within our facilities where PHI and/or organizationally sensitive information is stored or utilized, such as the following: in the receptionist stations, business office windows, client care hallways or treatment areas, offices, storage closets and cabinets, accounting, human resources, administration offices, or the IS department, employee meetings, rooms, or kitchens in the departments, and areas containing potential safety hazards such as medical imaging, lab, nuclear medicine, etc. If you see someone in a restricted area not wearing a badge, kindly ask, "May I help you?" Then escort the individual out of the restricted area and to the area where he or she is visiting.